My name is Dr. Vibha Dubey. I am consultant pediatrician in SKG Hospital, Jodhpur, and visiting consultant in IIT Jodhpur and HPCL, Pachpadra. Today, I will be dealing with a topic which is called Attention Deficit Hyperactivity Disorder. Have you noticed that it is very difficult for you to make your child sit at a place? He is always on the run, always moving around. He is not focused in doing his homework. Then this topic is for you. ADHD is a triad of inattention, hyperactivity, and impulsiveness. It interferes with normal functioning and development. It is not diagnosed in very childhood. It is only diagnosed when the child starts growing in the school. In the childhood, parents just think that the hyperactive child, maybe he is just a child and he's playing around and all, and they don't take it seriously. Once the child goes to school, the teacher complains that child is not behaving like other kids. It is very difficult to make the decorum in school because of him. He is not able to sit on his chair. He keeps on continuously interrupting others in their job. The problem with ADHD is that they are not able to develop fully according to their intelligence because of this. Now it is divided into two groups. First group is inattention and second group is hyperactivity and impulsiveness. First, we will discuss inattention. Child who shows inattention may have difficulty in staying focused in any game or play. They may misplace items required, their personal items in school or at home, like their books, copies, then geometry box, then pencil, rubber, eraser, toys, like that. They can be easily distracted. They are not able to pay close attention to details and they make careless mistakes in schoolwork. It appears that they are not listening even when spoken to directly. They have got difficulty in following commands, and because of that, they don't finish their schoolwork, etc. properly. They often have difficulty in organizing tasks properly. They avoid or have aversion to tasks that need focused mental attention. Like suppose they have to do a drawing in detail in which little details are there, they will leave it in the middle only. They are not able to finish it. If they are told to do some daily activities, they might forget some activities. Now coming to second group, hyperactivity or impulsiveness. The symptoms are they are continuously on the go or in motion. Like in the class, everybody is sitting, all kids are sitting quietly, but this child is not able to sit quietly and is on running in the class. They run around or climb in situation where it is socially inappropriate. Like suppose they have gone in a gathering and everybody is sitting quietly listening to the program or watching some show, and they will get up and they will try to climb the stairs and move around in between the audience like that. Even if they are made to sit at a place, they will fiddle with their toes or they will just shake their limbs continuously. They have difficulty in waiting for their turn. Suppose they are asked to do some activity quietly, like playing or making a drawing, they have difficulty doing that. They talk too much. Suppose some question is asked to them, they will blurt out answers and they will interrupt the questioners in between only. Now coming to causes of ADHD. It is not easy to pinpoint the exact cause of ADHD. It can be genetic, means it can run in families. Sometimes it can be linked to intake of alcohol or any smoking by mother during pregnancy. Sometimes it can be linked to a preterm delivery. Sometimes it can be linked to delayed cry. But exact cause is not known. Some people link it to the underperformance of some part of the brain, and some people link it to the imbalance of some hormones. But still exact cause is not identified. Excessive screen time in first 5 years of the life can also be damaging, and it can result into attention deficit hyperactivity disorder. Now how to diagnose this condition? Diagnosis is generally done by pediatric psychologists It is a purely a clinical diagnosis, and there aren't any tests to diagnose this questionnaire. They diagnose it by the base on the basis of some prepared questionnaire, which they ask parents to answer honestly. They also try to diagnose it on the basis of other causes of learning difficulties. Now coming to treatment of this condition. There are certain drugs, group of drugs called stimulant, which can be prescribed to these patients, and it is which drug will be prescribed and what doses will be given will depend upon the symptoms of the child, and pediatric psychiatrist will decide upon it. These kids also need special education, and structure and routine of the child is decided by special educator, and he counsels the parents, the teachers and the student. Behavior therapy. Behavior therapy is very important in these patients, and if they are told how to behave properly and if they maintain the proper behavior, they are awarded by some gifts or something. Social skills training is very important, like taking turns, waiting for their turn, keep seating in the class, etc. Psychotherapy is also very important. It teaches how to deal with the frustration in a better way. And psychotherapy of parents are also very much required because they are under a lot of stress. So, counseling and psychotherapy of parents is also a must. Diet and exercise. Good diet, aerobic exercise, meditation, pranayama, they are always important in making a child more focused. Now coming to support group. The idea of support group helps a lot. There are so many parents in the society whose children are suffering from this disorder. They can make a support group and they can discuss the ways how they have how they are coping with the situation. That can help to reduce the stress on the parents because they can feel that there are others also who are dealing with this situation in a very positive manner. And finally, it is very important for parents to be positive, and they should know that after initial struggle, they can change a seemingly failure life into a very successful one. So, I have told you whatever I knew about attention deficit hyperactivity disorder. If you like this topic, kindly like, share, and subscribe, and don't forget to press the bell icon. Thank you.